Hello, this is Robert, and welcome to my channel. If you're a doctor, a nurse, or another medical profession, and you struggle with OET, or even if you've taken the OET and you failed, I can help you. Stay tuned. Like and subscribe my channel to learn about my latest videos and more about OET and the practice of medicine in English-speaking countries. Look in the description. You can learn more about my channel and some books I've gotten recently, the OET trainers for 2023 and beyond. And we'll talk a little bit why they're different. Today I'm going to talk about the new OET speaking test. So for a long time, I taught doctors speaking tests from a PDF book that's widely available online called Futureland. And the Futureland had a lot of cases, still has. Most of them are outpatient settings. They will say suburban clinic, city clinic, community medical center, doctor's surgery, which just means doctor's office in Australian English, not a surgeon. Even an emergency room when you don't have a trauma case, it's all basically the same. That there's some examining rooms, and the nurse or the staff places the patient in the examining room. And she says to the doctor, "You have Robert in room 3 with a sore throat." So he comes in and introduces himself. And a lot of the cases go like that, where you diagnose and treat the patient. You also have, going back, these are new patients who you don't know, and of course with a new problem. So they meet you, their new doctor, and they tell you what's wrong. A sore throat, a headache, or sleeping medicine, pain medicine, the back hurts, something for themselves, their child, or their elderly parent. Now, you also have cases where an old patient is returning on your request. So, Joseph, I wanted to talk to you about the biopsy you had last week. Is that okay? Yes, doctor. And then you proceed with your tasks. Another kind of a case is where an old patient has returned again, and he's making the request. Maybe he thinks the mole that you examined last year has gotten larger, or you've prescribed sleeping medicine or pain medicine, and he would like a refill. So there's this kind of case. And all of these, we greeted the patient differently. Hello, I'm Dr. Roberts. How can I help you? Jonathan? Yes, nice to meet you. Hello, Jonathan. Nice to see you again. How have you been? How can I help you today? The old case. Old patient with a new case, rather. Or, so Jonathan, I've asked you to come in today to talk about the test results from last week, about your blood sugar. Is it okay if we discuss that? And you go on maybe to tell the patient they have diabetes or something. Now, most of the cases I've ever heard or saw went like this. However, the new books have cases where the tasks and the introduction starts in the middle of the visit. So it seems like the patient has gone to the doctor's office, been greeted either as a new or old patient, been examined, and then the doctor has gone to talk about what needs to be done and what the diagnosis is. Now, these new cases are longer. You have more tasks. And if you know me, or you will know me if you keep watching my videos, that I very much emphasize structuring speaking cases as well as writing cases correctly. And you can overcome your lack of fluency and get a passing score, get a B. So these new cases have more tasks. Now, there's a lot of material out there, even official material from OET that maybe says you don't have to do all the tasks. I teach you to do all the tasks, at least to accomplish the things that are in the task. So what do I mean? The patient's first task is to tell you they have a sore throat for 3 days and it's hard to swallow. Your first task is ask the patient the symptoms. So if the patient has already covered that, you don't have to do it again. So in that way, you don't have to do all the tasks. But be very careful about specifics, either with the old test or the new test. That there's a case that I always start teaching people with where the patient wants sleeping medicine. And the doctor's first task is to say, well, I really don't like to start you out on medicine for sleep because the sleep you get this way is not as good as natural sleep. And sleeping medicine can be habit forming, or the task says actually on the card can cause dependency. So many of my doctors start right off talking about alternatives, exercise, diet, alcohol, sleep schedule, turn off the mobile, turn off the TV, something like that. And they don't say the dependency. The patient's next task is to say, get angry at the doctor because he said you would get addicted to the drug. So remember, these things are scored by a professor, not by the interlocutor. And she's listening. They don't have video. She's listening to us, to the interlocutor and the candidate, the doctor or the nurse, and reading both cards. He didn't say dependency. I think points are going to come off here. See, you get yourself in trouble. So you need to practice, and you can do this with me or watch my videos to learn what facts in these tasks you must include, because they may come back to bite you when the patient speaks, or which tasks are more general. Maybe the sleep, this addiction, this dependency, you must include. If you see that you are to prescribe a patient amoxicillin, they want to hear you pronounce amoxicillin because they're testing you on that. And also, you don't want to skip, I'm going to give you some medicine for that, say something like that, because the patient's next task may be, I don't want to give my child antibiotics. They have side effects. They cause problems. I don't want to do that. So learn what is important. Anyway, on the new test, I thought this was really scary, but I think they're not that bad on the new speaking test this year. And again, my students who have taken these tests say they're very much like the ones in this book. So here's the book. This is the medicine trainer. You can get on Amazon. You can get through my link in the introduction to this channel. And I have the one for nursing. I haven't looked at too much yet. I don't have so many nurses as doctors. So I really recommend these books. When you get the book, it's a scratch off here. And when you scratch it off, you get a code, and you can download the material. It's not good forever, but I think for 18 months. And you have listening, speaking, writing. Let's see if I can see a speaking card here. There are speaking cards, right? I don't know if you can see like that. And when you get the book, you can also put them on your computer so it's easier to see. If you take individual lessons with me, I will use some of this material as well as some older material to help you. So this is Robert. Again, like and subscribe. Nice to see you here today. That's all I have. See you on the next video.